think patients frequently are concerned anytime they have to have a repeat operation for an operation that was supposed to have taken care of their problem initially. Oftentimes these patients are coming to the doctor, though, because they're debilitated by pain. As these implants start to loosen, or if there's an infection, they can have severe pain, which limits what they're able to do on a daily basis. And so while they are certainly concerned, usually they're in quite a bit of discomfort, which is what brought them to the doctor in the first place.
We generally see a failure rate of, say, hip replacement of about 1% per year. So you would say that at 10 years, 90% of people are still doing well. And even at 20 years, 80% of people probably still doing well. But there are a percentage that do either wear these out rapidly or have another complication that we talked about, either dislocation or infection or something else requiring revision. So it's unlikely, but considering the number of artificial joints being put in throughout the country, and certainly even in this region, it leaves you with a significant number that have to be revised.
The last decade in particular, the materials are much better. So we recently looked up a series of almost 150 patients who had their joints replaced since 1999, and none of those patients over that 11-year period had any problems with mechanical failure, which is much better than the decade before.
It's usually more challenging surgery to recover from, and oftentimes feels like a bigger operation to the patient the second time around, which is also why it's so important to do it right the first time, because people that have revisions often will say this is much bigger deal than their initial surgery was. It's just a tougher thing to recover from.
You're having to reoperate on something that's been operated before, so there's more scarring around that site. There's been some bone removed because of the first operation, so you have less to work with, if you will, to correct their problem. But if the problem is relatively straightforward and there is adequate bone, then you can do a revision operation that may virtually last the rest of their life. So it's important to identify the problem early and correct it. It's no time for procrastination. There's an interesting statistic, and that is that 80% of surgeons who do hip surgery do 10 or less hip replacements a year. So that means that the majority of the hip replacements are done by the minority of the orthopedic surgeons, and at institutions like this where there is a large volume of surgery being performed.
Here we all have a specific interest in hip surgery, and in particular dealing with hip implants or previous hip replacements which for whatever reason have failed. Because of that interest, we're seeing probably more patients than most other centers in the area, which allows us to take better care of those patients.